your final exam is going to be the same format as your midterm exam. It's going to be pretty simple. It's going to be a complimentary exam, meaning everything is covered, and you're going to have 20 questions this time because it's a high portion of your total grade, and I don't want you to miss like a big portion by missing a question. So it's going to be 20 questions instead of 10 or 11. And I'll give you 1 or 2 bonus questions. So it's going to be probably 21 or 22 questions. And those bonus questions would help you boost your grade. For your final project, you have until May 14th, midnight, because I have to post the exams the day before that. If you want to, and it's going to be pretty simple. I've already put a guideline. I will put another guideline with a sample, just a few pages of what you've done, and a brief explanation on the project would be sufficient. And for the online students, I'll post another announcement. Yes. Yes, May 14th. And it's going to be the same time as your exam. Okay. You don't need to necessarily present it in the PowerPoint. You can just put it like a minute video or a 30-second video if you build something and just presents that. That would be enough. And it's going to be anything that just has a sensor is going to be acceptable. I don't think I can cover the entire slide today. And it's not important. The second half is not that important. It's just for those students who want to learn more about biomedical and biosensors. The topic of today's class would be Introduction to Biosensors. Biosensors and biomedical equipment are a very important part, and it's actually a very important branch of electrical engineering. If anyone is interested in doing master's or PhD, this field is currently one of the highest paying jobs after you graduate. And there's a big demand for biosensors and medical devices. Anything like MRI, CT, X-ray, PET, all these tools, echocardiograms, sonograms are a substation of the biomedical engineering. And there's another field, what we call telemedicine or mobile health, which is anything that you can be attached to your body, and usually it goes through a phone, connects to the internet, and it's a real-time data sharing system that your doctor could see. And the other field is what we call bioinformatics, and the biosystem part is for detecting new drugs. They are using machine learning AI, and it's for drug delivery, drug detection. It's for cancer drug detection, and so on. So there are different fields in biomedical engineering as well. Now, the things that we know about human anatomy and the way a human body functions hasn't advanced in the past 50, 60 years. We know that we have a liver, heart, what the brain does, down to the cell. The knowledge hasn't increased. And if you look, to the Gray's Anatomy, which is the book, and the book that we have, not the movie, the actual book is also called the reference book. Nothing has changed that much. And the only thing that has advanced very fast and quickly is the technology. And now doctors have become operators more than doctors. If you go to a doctor right now, the first thing they would prescribe is a blood test, a complementary blood test, or they will send you to a medical imaging to do the diagnostics. Without that, they can't do anything. 50 years ago, we didn't have a CT, MRI. Now we have those devices, so you don't have to cut open someone open to just do a simple diagnostics. And also treatment has become very, very efficient and targeted, and what we call personalized treatment. Now you see we have radiotherapy that hits a point, which is like hits it down to the cell level. So you can pick which cells you want to hit, and it's going to destroy it. So it's becoming very, very accurate. And but the technology, again, it's improved significantly. I used to work in biomedical devices for eye disease detection. One research that I worked on during my PhD was detecting eye diseases using smartphone cameras. And we had a patent, two patents, and we actually licensed those patents to a company to build those devices. And there were three main diseases: cataract, keratoconus, and glaucoma. Most of you have heard about cataract. It's the blurring of the lens. And what happens is almost everyone would get cataract in a point of their life. It's too much exposure to UV, and some people have genetic, mutations for that. And the lens becomes blurred, and after a while, you can't see. And the cornea sometimes also becomes affected as well. 20, 30 years ago, the thing that doctors did, they would cut open the cornea and take out the lens, and they didn't know what to do, so they would just shut the cornea and they would put large glasses. So if you look in old pictures, you will see people with old people with very large glasses because they didn't have any lenses left. And then 30 years ago with LASIK surgery and sonogram, what they do is basically they target the lens and they break it. It's like similar to microwave, but it's not microwave. It's actually ultrasound. Same technique they use to break kidney stones, and that's another medical device. So, and they, break the lens. They have a small needle. They suction that out, and they push another artificial lens in. It takes like 30 minutes, and you go home the same day. Another type of surgery is LASIK surgery. Now, 80-90% of all eye surgeries are done with lasers. And if you look at all of these progressions, all of that has been done by electrical engineering. So all these medical devices, like sonogram, other example would be if someone has, I don't know, a stomach ulcer. Previously, they had to cut open the stomach. Now they do it simply by endoscopy. So it's a small camera and a very small, I would say robotic arm. And the camera is connected with a fiber optic right now. And you can easily see inside the stomach and take samples and send them for pathology, for example. Another aspect is robotic surgery. Now, around 60% of our surgeries are robotic surgeries. They have multiple hands, the Da Vinci device. I don't know if you heard that. Again, that is a robotic surgery type that it's a minimally invasive, and they do just one or two small cuts, and they don't have to open someone to, do a surgery. And the recovery time is like most people just go home the same day when they have type of surgeries. So the medical field has advanced because of the technology behind it. And most of that technology is coming from robotics, electronics, and electrical engineering is having a huge effect on that. And there is a lot of space for growth as well. Some fields we have almost reached the end, I would say, like power systems until like 5-10 years ago, until we had renewable energies and smart grids and AI mixed in. But still, we are capping it. We're reaching the limit. For biomedical, the limit is the sky. Until we find cure to every single disease, we still have space to grow. And electrical engineering is a big part of that. So doctors now have become more technicians, I would say, operators of these medical devices. And without these medical devices, most of them can't do a lot. It's going to, make it very, very difficult. So we have different sensing for health. And today is just going to be about the sensors. We're not going to speak about the treatment systems. And we're also going to just specifically focus on what we call wearable sensors. We're not going to go into MRI, CT. MRI device is just like, it's 3 graduate course classes just I did for one MRI device. It's very, very sophisticated machine. The size of the computing power is about this, half of this building. It has huge, computational complexity. So we have different sensing for health. We have vital sign sensors, we have disease sensors, and environmental sensing that we will only mention. And we have networking, the requirements for health use sensing. We have wired and wireless systems for sensing and cell phones as well. Now, different type of vital signs that we can measure. One is body temperature, blood pressure, pulse pressure, pulse oximetry, pulse EKG or ECG device, depending on where you are. They call it EKG in Europe, and stethoscope, pedometers, and weight, body fat measurement systems as well. And these are just some of them. We have a lot of like EEGs, EMGs, and I didn't mention all of those. Just mention some of these. Now, some of them are for disease monitoring, like for if someone has asthma or someone with diabetes, or hypertension, high blood pressure, or someone has arrhythmia, heart problems. They could use different sensors to be able to monitor their disease. Now, some environmental sensing that some of you have done for your project is going to be for air quality, measuring pollutants in air, measuring green gas emissions, CO2, nitrates, ammonia, toxics, so on. Water quality for bacteria, virus, even salt measurement, arsenic, lead. A lot of that could be measured with these sensors as well. Now, the first part that we want to focus on are what we call portable and wearable sensors. And the easiest one that you're all familiar with is the thermometer. We have two main types of thermometer. We have the contact type and the contactless type. The contact type is you put it directly on the skin, and it's the one on the left. This one actually connects to a hospital, device and measures your body temperature continuously. And the one on the right uses infrared to measure body temperature from a distance. And all of them are now electronics. They're pretty cheap, very fast. This type is more accurate than this type because the body, when you get it from a distance, it may have some errors. But still, they are very accurate, like 98, 99%. And again, they're pretty cheap. They were used a lot during COVID. Instead of having this thermometer, a lot of places like airports or hospitals use infrared cameras so they could scan 200-300 people at the same time. The infrared camera could measure the body heat, and if someone has a fever, they could easily separate them. Another type of sensor is the blood pressure monitor sensor. We have cuffless, and also some types are the cuffless type. It doesn't require to block the blood pressure. The cuffed one blocks the blood pressure and slowly releases it. I think most of you are already familiar with this. We have different types. Some of them are attached to the wrist, some are on the arm, and some are even on the finger. And the ones that are close to the heart level, especially the arm one, is the most accurate one. So the arm is the one on the arm because it's the same level as the heart is the most accurate one. And that's the reason when you do the wrist, you have to put your wrist at the same level as your heart, but it's not as accurate as the arm one. We have two type of blood pressure. Do you know what are they? Two different factors. We have systolic and diastolic blood pressure. So systolic is the upper one and diastolic is the rest one or the lower one. For a normal person, it's going to be between 12 and 14 for systolic, or 120, 140. And the diastolic would be between 60 and 80 or 6 and 8. The way that they measure it, first, you have like an air pump or a mechanical device that completely blocks the flow of blood. So that's the reason you hear that pump and it blocks it. It slowly then releases the air. And when you release it, at a point, which is the systolic point, upper point, you would hear that the blood is starting to pass, and you hear the pulse. And there is a sound we call the knuf. It's exactly what it sounds, knuf. And the older method was they would put a stethoscope. I don't know if you have seen them. They would put it under the air, the cuff, and they would listen to that song. When they hear the upper, they would record that, and that pressure is in millimeters of mercury. And then when they don't hear that sound anymore, that's a lower one. So what is a diastolic and what is a systolic? Diastolic is your resting blood pressure, and it shows actually the stiffness of your veins, because veins are also flexible as well. But if someone have a lot of cholesterol and they have blockage, the artery becomes rigid, and that may cause some problems like aneurysm or something like that. And that the systolic is the upper one, which shows how much pressure is in your veins. And obviously, if someone has hypertension, which means high blood pressure and it's chronic disease, it could damage kidneys. It may cause a stroke. So some people need to continuously monitor this. Previously, you had to do that manually with a stethoscope. Now we have these digital devices, but these digital devices have a limitation. Each time they want to measure blood pressure, they have to pump. You can't measure blood pressure continuously. That's the reason in the hospital, when they attach one of these every 20 minutes, 10 minutes, it has an interval. It will pump, measure the blood pressure. And because if you block the flow, you're going to lose the ARB. And we don't want to do that. So there are methods, and we worked on a paper actually to do continuous blood pressure measurement just using PPG or your smartwatch, like an Apple Watch. The accuracy is not still yet like 90%. Anything that we build in medical, the accuracy must be above 95%. Below that is not acceptable. So the only problem is that they are not continuous, but now they are very cheap. You can have it at home. You don't need to be a doctor or nurse to get a blood pressure, and it saves a lot of lives. Now, why do we need a continuous blood pressure? Because some people, there is a syndrome, I forgot the name of it. They have normal blood pressure during the day, but during sleep time, their blood pressure goes up. Or when they lay down, it goes down. But when they're normally sitting, you don't see that hypertension. So they like to have that continuous round-the-clock blood pressure to see what happens when they're sleeping, they're walking. We have those devices for heart rate measurement, but we still don't have them for blood pressure measurement. And even blood pressure during the morning and afternoon is different. So again, another type of sensor is the pulse pressure sensor. Again, this is mainly used for continuous pressure monitoring, and it's also used for blood pressure monitoring as well. And the sensor that we use in these is a piezoelectric. It's a pressure sensor. And the way that it works, that air goes through a pressure sensor, and sometimes we even have a microphone that we can catch that sound, and we can actually measure the pulse and therefore measure. And sometimes it's much more accurate than a human as well. So now another type of sensor that we have is called pulse oximeter. This device measures two things. One, measures heart rate. And the second thing that it can measure the oxygen saturation level. Oxygen saturation level is very important, especially for someone with a lung disease or something like that. And if it's just measuring pulse, it will use one light beam around 650 nanometers. If it's measuring both heart rates and oxygen level, you need two different light beams. And these wavelets are absorbed selectively by oxygenated and non-oxygenated blood. So it's between the artery and vein. And an oximeter signal varies at pulse rates. This is actually from a paper that we had, and it shows how it works. So we have a photodetector, and we have an infrared or a light source. It could be even a white light source, red light source. The best light is the green light. Does anyone have a Apple Watch with them or a? Okay, so if you look on your Apple Watch under it, you would see there is a green light emitting all the time, and that is for measuring pulse. Now, one thing that is very interesting before I start this is the patent to measure oxygen level is from a company in Japan, it's Mosima, and that company actually sued Apple last year, and Apple from that on is not able to use their pulse oximeter to measure oxygen levels. And there was a stop on sale for Apple Watches, and after that, they got rid of that feature. That company, that Japanese company, owns the patent for that. But for measuring the pulse, everyone can do it. That's the reason you have these pulse oximeters. But for measuring oxygen level, it belongs to the Masimo Japanese company. And the way that it works, you have infrared, you actually have two types of lights, and you have two different types of pulse oximeter. You have the transmissive and the reflective. The transmissive is a little bit more accurate. It's the one that you put on the fingers. Obviously, you can't put a transmissive on your wrist. So the ones that we want to use on our wrist are the reflective type, which are used in wearable, Fitbits and Apple Watches and so on. So the one on the left is more accurate, and the way it works, different blood have, if oxygenated, deoxygenated blood have slightly different colors. If you look on your vein, you can see the red ones and the dark blue ones. So that means they would absorb different type of wavelets, light wavelets. And by measuring that, and reflecting a certain type and measuring the reflection, we can determine the pulse. And the pulse looks something like this. And this is a PPG pulse oximeter, or what we call a photopolyseismogram. And you can see it has an AC component and a DC component. And again, it's a diode, light, and a photodiode. It's as simple as this. And it has a microcontroller. And the upper one, the red one, shows the pulse. The DC is a steady, stationary. The tissue, the veins, the capillary blood doesn't change, but the AC part, because the heart is pumping, so that is going up and down. Okay, and if you put your hand on your pulse, you can actually feel it, and light can actually absorb it better. And with that, you can measure the heart rate. Now, if you have two type of different lights like red and infrared, using this equation, it's a pretty simple equation. You can measure what we call SpO2, or oxygen saturation. And oxygen saturation gives us very useful data, such as if someone is having lung problem or heart problem, or if someone has having stroke or internal bleeding. Because once someone is having a stroke or internal bleeding or blockage in their arteries, the level of oxygen drops significantly, and you can see that. So that's the reason if there's a EMC, car crash, and someone comes to the scene, the first thing they put is a pulse oximeter to see if someone is having internal breathing. And the same thing is in a hospital they will put on. The good thing about these are very comfortable, continuous, low power. Most of them are battery powered. So if something goes wrong, these are connected via Bluetooth or wire to a station, and the nurse can see it in a station. They can follow the heart rate, and they can also follow the oxygen level. And this gained a lot of traction during COVID as well, because the first thing COVID did was it would affect the lungs. If someone has, pneumonia or something like that, it's going to be the same. And the blood level, oxygen level is going to decrease. Now, there are different, there are other useful information that we get from this sensor. One is what we call AF, or atrial fibrillation. It's when the heart gets out of rhythm, and you can easily measure that with PPG as well. So if you have an EKG or a PPG device, sometimes you can even predict if someone is going to have a heart attack in the future up to 1 year before that. You can easily see it a month before, and someone, if it's having a heart attack, you can easily see it with these PPG, especially EKG device. With the EKG device, if you have enough leads, you can see exactly which part of the heart has a blockage. So you can see if it's, which muscle, which artery is going to have the blockage. Now, the only drawback for a PPG is it's very sensitive to motion, because when you move your finger, there's going to be a distance between the light source and your finger. You're going to have motion, and that's what we call motion noise artifact, or M&A, and it will look like this. So instead of having the clean sense, there are ways like software and hardware that we can reduce that. And we can get rid of these noise. But there's just a field to get rid of the noise from PPG devices. Now, EKG, or electrocardiogram, is a complete different story. PPG works on light, and it uses light sensors. EKG works on electrical sensors. So I don't know if you're familiar, but your whole body is working on a clock, a crystal. That crystal creates it's like a crystal. It synchronizes your heartbeat, and it's from a node that we call SAP A node and SA node. It's about the size of your, nail, about like 200 cells, something that. That creates a shot. It's like an ignition in your car, and it's like a crystal clock in a microcontroller. That actually is controlling your heart rate. If something happens to that, people are going to have a heart attack. That's the reason we have these CPR devices, shocks. When you shock a person, it's going to reset that clock. Okay, and that SA node is right around here, actually. It sends a pulse, it goes around the heart, and you can see the signal. And this is what we call PQRS, and I'm going to get into the details. Now, if someone has a food or that interrupts this, or has a certain drug that it has allergy to, or some genetic or diseases, then this pulse would get out of rhythm, and that's what we call arrhythmia. Someone having arrhythmia. So instead of a normal pulse, they would, instead of going like dup, 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 they would go dup, 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 dup. So instead of, doing the normal one, it would go fast, it would stop, and then it would go fast. Now imagine someone's heart stops just for 10 seconds during sleep. It's gonna, you're not gonna live after like 40, 50 seconds. Most of these strokes happen because you have a heart attack, and then oxygen doesn't reach your brain, and then people have strokes or something like that. So it's very, very, very important. Even sleep apnea has effect on heart rate and heart arrhythmia. Now, when you start exercising and running, the body sends signal, and this SA node starts rising. So your heart rate elevates to around like 160, 70, up to 200, and then comes back. So you have a resting EKG, which is below 100 is normal. Some athletes which have big hearts, even their heart rate is around like 50. The normal is between 60 and 100, but some people that have big hearts, because it doesn't need to pump that hard, maybe they will have like 50 for resting state. Now, how does the EKG device work now that we know the physiology? It's a normal electrode. It's 2 conductors that you put on the chest or on your wrists. It must be on the different opposite sides of the heart, and it measures the voltage or the electrical potential differences between 2 parts of the body. Those electrodes are usually made out of, I don't know if you've seen those patches, those aluminum with a gel around it. That's to make maximum contact with the skin and stay connected to the skin. But even if you put your finger, I don't know if you've seen the Apple Watches, which have EKG, you have to put your finger on the volume knob. So the lower part has a ring that is connected to your wrist, and your other finger works has an other electrode and makes a connection, and you can measure the voltage difference. And when you do that, it gives you a signal, an EKG signal, which you don't see here, but an EKG signal looks similar to a PPG sensor with small differences. EKG sensor is usually like this. So we have the P, it's like this actually. So we have the PQRST, what we call PQRS and T signal. And if someone, as mentioned, has arrhythmia, it would do this and it would do this, so on. Now we have 2-lead, 4-lead, 8, 12. Someone has been in the hospital and they are, they want to do a complete checkup of their heart. They'll put multiple leads. They would put 2 on the ankles, 2 on the hands, and multiple on the chest, and also on the back as well. That gives you a 3D picture of the hearts and which muscles of the hearts are working properly and which ones. So if someone is having a heart attack, you would see that the signal, for example, that is connected between the front and the back, that one has a weird signal. It means the muscle between these two is not functioning well. The muscle is dead or it's not working very well. So these are the ways, and EKG is the fastest way, and it's very easy, very cheap. Now they have built these patches that you put on the chest, and something that we call Holter monitoring. I don't know if you've seen that. They will put it on someone's body and they send them home for 2 weeks because, again, heart rate goes up and down during the day, during sport, and they will record that and bring that back and analyze that. Now, another type of sensor is called the electronic stethoscope. Stethoscopes you're already familiar with. Nowadays, they are building the electronic ones. They have a microphone. They could record everything. And now some of them have AI, and the doctor doesn't even need to see it. It would detect if there's any anomaly in the system or on the heart. It will also connect to your phone, your computer, the hospital's computer. And some of them are even wireless. You just put that on, the chest or on the back to, hear the heart or the lung and so on. And we also have exercise pedometers, Fitbits and so on. They can measure, they have an accelerometer and a gyro. They can measure, calculate the number of steps, your activity, the number of calories that you burn and so on. They're also called fitness bands as well. And the simplest one, we have electronic weight or body fat scales as well, which use 4 pressure sensors at the bottom. When you stand on, you can measure your actual weight. And other type of sensors also exist. These utilize the AirPods or microphones or headphones that you have to measure, to record your breathing, and it analyzes your breathing. And if someone is having an asthma attack, it would, give them notification or let someone that is close to them know that someone is having an asthma attack. Now, if we go back, each of these sensors are using different types. The first one is using light. So if the exam, I would ask, PPG, what type of sensor? It's using a light sensor. It's using a photodiode. You can also do PPG while using remote PPG. So if you simply have a camera, you can sit someone like 10, 20 feet away, and you can measure their heart rate. As soon as you can pick part of their skin, like their forehead, you can easily measure their heart rate from a distance. So it uses a photo detector and a light source. And the next type is EKG, which is using simple electric conductors to measure voltage difference. A stethoscope is using a microphone. An exercise pedometer is using gyroscope, and also accelerometers to measure the movement. A weight body fat scale is using pressure sensor. A blood pressure also is using pressure sensor as well. I forgot to mention this. A thermometer is using infrared. And another type of sensor is asthma or breathing. This measures the lung capacity and lung pressure. This is also using a tube, and on that tube you have a pressure sensor that you can measure the volume of air that is going into the lung and coming out, and also the flow, the pressure, everything. Usually it looks like this. You just, breathe into it. In some hospitals, they also have this as well. And it's for someone that has an asthma attack, or has pneumonia, and they want to measure their lung capacity. Now, there's another type which is called the electronic flow meters that stores reading. And again, this measures the flow of breath. And it comes in different shapes and types. Now, one of the most prevalent, one of the ones that are very famous and you already know about, is the blood glucose monitoring system. It came out in the 90s, and the way it works, it's actually has a chemical, it's an electrochemical device, and you put a drop of blood from your finger on it. It has an electrochemical reaction, and I'll show you that. And that electrochemical reaction looks like this. You have an enzyme, and I will show you what the enzyme is in a blood glucose monitoring system. And when the blood comes in contact with an enzyme, it breaks down. Usually it creates a static voltage or current. And the device itself is just a voltmeter or an ammeter. That's the reason the glucose devices are cheap, but the strips are more expensive. That's actually the business model. The strip is also extremely cheap. It's like 1 cent, but they make the money out of the strips. It's like the printer business, So, and there are just a couple of companies now that have patents to these. The patents are expiring, so a lot of companies were able now to build them, I think, in the near future. So the price is going to come down. But the base for all of them is the same. And this is for a lot of different sensors. Like, for example, if you have a water quality sensor and you want to measure the methane in it, you want to measure the nitrogen, you want to measure oxygen saturation or oxygen levels in the water, you want to measure carbon dioxide methods. Each of these, you have a different enzyme that could bond with that material and it would generate electricity. Even we have stripes for measuring, for detecting viruses or bacteria. It's the exact same thing that they use in the labs to do blood tests. So in blood tests, they measure the amount of iron you have, the amount of, they count the amount of hemoglobins and white cells and so on. Those are actually using pictures that do that. But these enzymes do a lot of things. Now, they are fast, low cost, high sensitivity, and they're very easy to miniaturize. And these are the equipment for developing electrochemical biosensors. We have an insulator, we have the electrode material, and we have the protein film. And this is actually how we do it. And it creates a cyclic, we use a cyclic voltmetry system to be able to measure different voltages. Now, this is an example of a system that has different voltages depending on different levels of chemical in different currents as well. And this is the basis of a blood glucose monitoring system. And basically, when you add the enzyme, it oxidates the blood and it bonds with the sugar. And as you know, sugar or glucose has these hydrogen, carbon, and nitrogen. And when they bond together, when you oxidize it, you add oxygen to it. You have the FC plus the glucose plus the enzyme. It's going to take out the glucose and it's going to generate a little bit of voltage. And as mentioned, the mediator shuttles electrons between enzymes and electrodes. And the catalytic enzyme electrochemistry of it looks like this. And this is the actual chemical reaction that happens when you add the enzyme. It's going to create extra electrons and oxygen is going to get out. And most sensors use an enzyme called the glucose oxidase, or GO. Most sensors are constructed on electrodes and use a mediator to carry electrons from enzymes to GO. The FC is the mediator. Each company has their own chemical formula. Most of them are secret, are trade secrets, or patents. That's the reason if you take your blood glucose with one device, like Accu-Chek, and you do it with another device, you may have different results because they are using different methods. Now, commercial glucose sensors, these are the biggest biosensor success story. It helps diabetic patients to monitor the blood glucose at home continuously. Previously, if someone had diabetes, they had to go to a lab, do their fasting glucose levels. And if they needed insulin, then they had to take it. So during the night, if they had high blood glucose or low, there was no way to find out. They had to wait until the lab was open. And even then, when you took a test, it took like 24 hours to get the results. And some people, unfortunately, would die if they had very high glucose level. They would go into shock, or low glucose level and didn't know it, and they take insulin, and again, it's going to be very dangerous. But now, with these glucose monitoring sensors, you can easily measure it at home. It was first made in the early 90s, and now we have 5 or more commercial test systems these are the ones that are well known. We have rapid analysis from single drop of blood, and the enzyme electrochemical devices are now very compact, and they're on a slide, and this is the flowchart of how its system works. Previously, they were very bulky. You had to draw a lot of blood, but now it's just a single drop of blood would work. And you put a single drop of blood on the enzyme, and you have the mediator that moves the electrons. And the device technically just measures the voltage difference. And when it picks a voltage, it just measures it. But it's a very accurate, measurement tool. And that's the reason you need to calibrate it every now and then. They have like these calibration straps that you put in, and you reset it and use it again. The newer generation is called the CGM, or continuous glucose monitoring. They are these glucose patches that you put on an arm or on leg or something, and it continuously measures glucose levels. And there are also insulin pumps that are connected to those, and it would automatically inject insulin for type 1 diabetes. the most known diabetes. We have type 1 and type 2. Do you know what the difference between type 1 and type 2 is? Yeah, type 1, usually you're not technically born with, people usually get it in a very young age. It's an autoimmune disease. The immune system starts attacking the pancreas, and it destroys the pancreas, the ability to produce insulin, because the pancreas is, responsible for producing insulin. So the body is functioning normally, but they can't produce insulin. And 100 years ago, that was a unfortunate death sentence until they came up with, they injected large amount of sugar to horses and then rabbits, and then they extracted and purified insulin, and they did it that way. Nowadays, they are using a different technique. I'm not going to go into the details, but diabetic type 1 is that. Diabetic type 2 is a complete different story. Usually you get it, and people get it at old ages, but even like kids with obesity may get it as well. That's the response of the cells to insulin. When there is a genetic factor, and there's also obesity has a big role in it, is that the cells stop responding to insulin. They become insulin resistance, meaning the body produces enough insulin, but the cells, because the cell is getting the insulin and getting the sugar and making energy out of it. So what happens is when you are not sensitive enough to insulin, the body cannot process glucose. When the glucose goes up in bloodstream, it creates a lot of inflammation and problems. If it's not treated, it will ultimately, create blindness. I don't know if you've seen amputated legs from diabetes. The reason is that when someone gets diabetes and they have it for a long time, they have inflammation and they get these wounds in their foot. And the problem is people with diabetes, they can't sense because their nervous system can't sense, and therefore the wound also heals pretty slow. So they will get wounds, they won't understand that they have it, and it will get worse. And finally, the only solution is for amputation. That's the reason it's very important. It's a chronic disease, so you have to keep track on it. If people stay on top of it, it's not a big deal. There are different medications that they use, like metformin. And recently, interesting, there has been a lot of research around metformin. Metformin was, discovered 80 years ago, so it's pretty cheap now. And it has shown some promises on longevity as well. Some people are just taking it now to live longer because it has its own benefits. Anything that you can do that will reduce blood glucose actually contributes to longevity as well. Because the human body, the moment you are born, technically you are being cooked. Because the more you get glucose, the cells are replicating, and there's going to be some mistakes in the replication of the DNA. So technically, human being, the moment it's like something that is being cooked. So less food, less energy that you have, you're going to slow that process. One way to slow that process is going to be fasting. Anyway, I don't want to get into the details, but the thing is, so we have two types of diabetes. Type 2, even, you need sometimes insulin. Type 1, there are newer medications that are used, and there are these cell therapies that they use. There have been a few successful patients that they would, make the pancreas to work again, but they need to get autoimmune suppressant medication to stop for attacking. Anyway, so both need it, and it's a very chronic and dangerous disease, so you have to be on top of that. Now, new research on glucose sensors. We have non-invasive biosensors. They are using skin or saliva. There are some researchers on PPG sensors, and they're actually getting pretty close. I think in the next 10 or 15 years, you won't need a drop of blood. Maybe these PPG sensor or smartwatches can monitor. And if it's non-invasive, it's going to be very easy. You can do it continuously. Obviously, you can't, it's going to be very difficult or painful. Some people don't like these CGMs. So they are working on other methods. Google worked for a while, around 10 years, on these contact lenses because you can measure glucose from saliva and water, tears, and something like that. But eventually, the problem is they had to put these sensors and microchips in a transparent lens, which was very difficult to achieve because it's it's going to be difficult to make these wires and everything sensors to be transparent. And by the way, contact lenses are disposable. They may cause infection, so it's going to be a difficult task. They are also working. I've seen some projects that they implement a sensor permanently on the skin, and then you have it's like a MagSafe thing that you can charge, and it will transmit data, and it's there. But again, most people don't like to have a small surgery to put something in their body to do that. So implantable glucose sensors to accompany artificial pancreas, feedback control, or insulin supply. Again, you can do these insulin pumps. Typical use of 3-4 weeks for implantable sensors in human. These are the CGM devices. But the problem is with inflammation and so on. And the other problem is calibration, because sometimes they start drifting. I used to use one for 3 weeks, and I don't recommend it because it's going to give you a lot of panic attacks and stress. But the problem was I saw it just drifting every day. It went higher and higher. So the last day it would show a blood glucose of 170, and when I tested with other devices, it was like 95, because it's going to accumulate around the sensor. You know what I mean? So some of them are not very, very accurate. So again, some methods are non-invasive that have some FDA cleared, but we are not still yet in terms of accuracy. Now, we also have other types of biosensors to measure, for example, cholesterol and antigen, and for example, measuring toxins, pathogenic bacteria, proteins, DNA genomics arrays and DNA damage assessments, micro or nanoarrays, and optical ABS or fluorescence for protein or small molecules. These fluorescence, they can even detect blood cancer. You can use camera to detect skin cancer. Also, these fluorescence can detect different skin cancers as well. So in 40, 50 years time, maybe everyone would have a device the size of their phone, and they could do like 50 to 100 different diagnostics using that. It's going to be very, very interesting. I think it's enough up to this point. I don't want to get more into details about them. And up to this point, the other biosensors, slide number 2 is going to be on your exam if you want to note that. So slide number 2 is the final slide that we taught for your exam. Your exam is going to be again May 14th, yes, at 10:15. For the online students, I will send them an announcement. Thank you so much and have a great day.